For you today, we're asking what went wrong and what we can learn from the handling of this pandemic over the last year. In his first in-person interview since the pandemic began, Kansas Secretary of Health, Dr. Lee Norman, talks exclusively with KCTV5's Joe Chiodo.
Were we lacking a unified federal response, and how big of an impact did that have over the course of this year?
Great question. Yes, we were absolutely lacking a unified federal response. And you saw where early on that Dr. Fauci and Dr. Birx and the real strong science advisors got marginalized and kind of pushed off. Having not only a presidential election, but then a contested one right in the middle of that was very damaging to the continuity of operation.
1 year and 529,000 deaths later, Dr. Lee Norman tells me his biggest disappointment has been states competing against states.
It's been a story of shortages. Remember early on it was PPE, it was testing equipment and testing solutions and contact tracers and therapeutics and now vaccines.
He does credit Operation Warp Speed for fast vaccine production, but a fight with our own neighbors remains today as we ask who gets a shot before others.
There's always going to be controversy as to who should be in what place. Probably the single flashpoint more than anything, and I'm very sympathetic, is people under the age of 64 that have chronic medical conditions that are in phase 3. But where does that come from? This is an ethical question. How much do you pay attention to an individual versus how much do you pay attention to a population?
For example, one individual who may not have contact with a lot of others who has a chronic disease, but an individual who works at the grocery store.
Boom, exactly that.
Confidence from the American public was tough to achieve over the past year. The CDC at first saying masks were not needed, then retracting that statement. Dr. Norman says it was an effort to protect healthcare workers who needed masks first, and a struggle to understand how the virus spread.
It did really confuse the message, and it discounted. We've never gotten back to what masks really deserve, which is a whole lot of credit. That mean people like them, but people are going to discount it. But in all honesty, when something changes, let's tell them when things change, when we were wrong. Let's come out and talk about that as well.
These new variants, how big of a concern is that to you?
It's big. It's not surprising. We're going to have COVID-19, probably a COVID-20, probably a COVID-21. There's going to be a variety of strains.
Dr. Norman tells me vaccines will be the saving grace. He believes the current vaccines should work against new strains, but only time will tell. And when the next pandemic hits,
yeah, there will be a next time.
He says what we've learned this past year will have us much better prepared. Joe Chiodo, KCTV5 News.